Hello, I'm Claire from ANF Australia, the Australian partners of ANF Academy. I am also an ANF Master Instructor and an ANF clinician at Clusie Clinic. So I would like to explain to you a little bit about what is ANF. The gentleman on the screen is Dr. Mikael Hoff. He's a Swedish doctor who invented ANF technology. So the potential of ANF therapy is to reduce pain and inflammation, and it does this within minutes. It's enhancing the body's natural ability to heal itself and self-regulate like it's designed to do. It helps normalize body functions and systems and increases the overall energy and well-being. The ANF discs are a wearable medical device. They're made of a carbonized metal, which is 22.8% pure metal, and it's the same carbon metal that is in the spacesuits. It was developed by NASA in the 60s. It's safe, it's strong, it's flexible, so you can wear them on your skin and still be able to move around. They're skin friendly with a 3M adhesive. They're a registered Class 1 medical device, both in Europe, the United States, and with the TGA here in Australia. They contain no chemical or organic substances, so nothing toxic is entering your body. It's the only material known that can send frequencies, receive frequencies, and reflect neurofrequencies. There's over 300 different types with pure frequencies embedded into them. We use them depending on what we're trying to achieve and what your ailments are. So the disc properties themselves they are activated with your body's own infrared heat. So as soon as you apply them to the body, they activate and become a part of your nervous system. They're effective, they hold their charge for 72 hours. So once they're applied, you have continuous therapy for 72 hours. No other health modality can give you that. They're compatible with showering, shaving, swimming, dancing, working out, sports, anything. Babies can also wear them. With the discs with children, you can have them on for up to 5 days or until they fall off, whereas with adults it's the 3 days. And you can potentially take them on and take them off, reattaching them with tape if necessary. So if you have them on display and you have something on that you don't want them to be visible, you can take them off, put them on a mirror and put them back on. The most important thing when you are having ANF therapy is to be hydrated. It's also the most important thing for your body to be able to be functioning. You need to be hydrated. Cells need to be hydrated. The fluid, the blood supply and the lymphatic fluid within the body needs continuous replenishment. So we suggest that you drink 1 to 2 glasses of water per hour, but stop drinking a couple of hours before bed so you're not up all night. And you want to have a very big, large intake of water when you first wake up in the morning. And if you are going to drink an alcoholic drink or a coffee or a tea, we would recommend that you have an extra glass of water. I also recommend that it is filtered water, just to remove the chemicals and mineralize the water that's lost during processing. How do you know that your body is hydrated? It should be a nice clear to pale yellow color. Anything darker than that, you have not drunk enough water. The last urine you do for the day before retiring should be that pale color. It's expected that your first urination when you wake up will be dark as your body is expelling toxins and you haven't had any water intake overnight while you're sleeping. The water is super important to reduce the detox effects that you feel once your body is starting to remove inflammation, and cells only work when they're hydrating. So when we talk about detoxification in the ANF therapy world, it's not necessarily, when you think about detoxing, you generally think about getting diarrhea or something like that. This is not like that. We are detoxing at a cellular level, and it's super important for the body to be able to remove toxins for it to then be able to heal. So when you apply the discs, as the body starts to regulate and heal, it removes toxins. So this can happen within minutes to hours after the application of the discs, and generally lasts from minutes to hours as well. The duration and the intensity of the detox depends on your current situation, your hydration level, and how old you are. So the way toxins enter our body is through our lungs, so we inhale them, absorbed through our skin, and ingested into our intestines. How is the toxins released? Through our breath, through our skin, and through our kidneys and our colon. And if we have an overload of toxins, they sit in our liver, our blood supply, in our muscles, our bone marrow, and in our joints. So we don't want toxins sitting there. So it's super important that when you get somebody in that is practicing ANF therapy that can help your body remove toxins from these areas. So the detox symptoms, the most common ones we find is dry mouth, fatigue, dizziness, headaches, lightheadedness, or general discomfort. Not all patients experience detox symptoms, and the more dehydrated you are, the worse the symptoms will be. The two most common I find is headache. Once you drink a lot of water, the headache generally subsides, and fatigue. It's just your body's way of saying, I need to shut down to do some healing. Less common detox symptoms are shivers, skin issues, so a rash or pimples or things, itchiness, a runny nose, flu-like symptoms, nausea and vomiting, and neurospasms or cramps. Again, not very common, and the more water you drink, the less likely you are to experience these. Plus, if the detox is too intense for you, you can remove the discs. We don't suggest that you do that because your body is wanting to remove toxins, so it's better out than in. When we look at the body with ANF therapy, we're not just looking at the symptom of your problem. So, for example, you have knee pain, you go to a normal health professional who doesn't experience ANF therapy, and they'll just look solely at the knee pain and maybe give you some painkillers to remove the pain temporarily, or some exercises that will strengthen the muscles around the knee joint. But, however, if the knee is inflamed, the muscles cannot strengthen. They need to heal before they can be strengthened. But what we look for in ANF is why that knee has the problem in the first place. My experience in the clinic, that maybe 80% of knee pain has got nothing to do with, 80% of knee pain is an inflammation in a tendon or some arthritis within the joint, all caused by inflammation. Now, also, I've found people with endometriosis can have knee pain, stress can have knee pain, lower back problems can be lymphatic problems, gut problems. So we just look through the body's hierarchy. So the bottom of the hierarchy is local tissue, so that's your muscles or your bones. Where it hurts is not necessarily where the problem is. Then we move into the muscles, and then we look at the organ function, and then we look at your hormones, and then we look at your blood supply, and then the nervous system, and then your lymphatic system and your gut. And of course, everybody knows stress is the #1 killer of people, so we look at your emotions. If you have high stress, your body cannot heal. So we would like to work with you to remove or reduce the impact of that stress on the body. The lymphatic system is your sewerage system and your immune system. So if it is not working and flowing like it should, and it is 15 litres of fluid, which is why it's super important that you drink a lot of water. If that is not flowing like a river and that's more like a sludgy creek, then you will not be able to remove toxins and waste from your body or send your immune system cells there to heal. So it's important that that system is functioning. The gut ties in with the lymphatic system. 80% of your immune system is in your gut. Everybody knows about the importance of your gut bacteria. A lot of our emotional happy hormones are made in the gut. It's also where we absorb nutrients. So you really need that to be functioning well, or your body cannot heal. Without good blood supply, there's not great oxygen or nutrients traveling to the area. Without oxygen, nothing can heal. Then with the hormones are responsible for creating chemical reactions within your body to get nerves to fire, to get muscles to fire, to get organs to do specific functions. And then there's your organs, of course. Without them functioning properly, your body doesn't care about joints and muscles and tissues because it's trying to keep the organs working. And then you get your muscles and your tissue. So it can take up to 10 years for your muscles to break down after a toxin or an injury. So we always try to find that initial insult along this hierarchy. So general recommendations and how long does the therapy take? It's different for everybody, but it's always advised that you follow your ANF therapist's individual recommendations because we look at you as an individual person. We don't say, oh, because you have knee pain, we're going to do what we did for the 1,000 other people that had knee pain and hopefully it works for you. We actually look at your specific needs and do treatments specific for your need. It's also recommended that you have a regular sleep time and get a good night's sleep because the body heals when it's asleep. Recommended that you're well hydrated and eat a healthy, well-balanced diet because the body needs different nutrients for different functions and to heal. You need a lot of good proteins. Avoiding sugars and inflammatory foods like energy drinks and soft drinks and fast food will enhance your body's ability to heal. Limiting your alcohol intake. Alcohol inhibits your body's healing abilities. And then how long does the therapy take is individualistic again because not one person has the same story, not one person has the same injury, not one person has the same treatment. The longer you've had the issue, generally the longer it takes for your body to correct that issue. So it can be 3 treatments through to months of treatments. It really does just depend on why you're here. And that will be discussed at your initial appointment. So how do we use the discs? Well, we do not cut or modify the shape at all because that will interfere with where the frequency is embedded into the disc. You cannot apply them directly over a wound, but as you can see in this picture, you can surround the wounds to enhance healing. They are a sticky device, so your skin must be clean and dry. And when you remove the discs, you don't just rip them off like a Band-Aid because they are well stuck. So we recommend that you take them off gently and generally in a hot shower or a hot bath after the 72 hours. And if you are having consecutive treatments and you've taken the disc off and there is a red mark, you just put the next treatment adjacent to that, adjacent to the skin irritation. How do we store the discs? Well, they all come in their own anti-static bags, so they must remain in their individual anti-static bags, and we mustn't mix different types of discs in each bag and keep them away from heaters or hot cars or any kind of heating source. Avoid using a hairdryer directly on the disc. It's too much heat. Don't use laser therapy, shockwave therapy, or ultrasound on the disc area, and stay away from infrared saunas during the treatment phase while you're wearing the discs because they will discharge very quickly, they won't last the 72 hours, and that will enhance your detox effect and not allow the body time to copy the frequency within the disc. If you are to have an X-ray or an MRI or scan of any sort, you must remove the discs prior. So thank you. I hope you've learned something, and we look forward to bringing ANF therapy into your life because when nothing else helps, this does.